People often ask me a very common question. Do women really use it or lose it? Asterisk. I'm Dr. Rina Malik, a urologist and pelvic health specialist. And today we're going to break down what actually happens to the vagina when someone goes a long period of time without sex. Let me tell you right away, most of the things you probably heard are myths. But yes, some real changes can occur in the vaginal and vulvar tissues, and it's important to understand them. So in this video, we'll talk about exactly that. And at the end, I'll share a few science-supported tips to help you keep your vaginal health in great condition, whether you're sexually active or not. Before we jump in, I want to quickly share something special. I get questions like, do you use it or lose it? Every single day in comments, DMs, emails, newsletters, and it's impossible for me to answer everyone individually. So to help more people get clear, reliable answers, I created a dedicated app. It's called the Better Sex App ***. It includes 12 structured modules designed to guide you based on your specific needs. Maybe you struggle with communication. Maybe you want to understand what's normal and what's not. Maybe you're dealing with menopause, erectile issues, or low libido. The app covers all of it. You get daily lessons, healthy practices, intimacy exercises, and a built-in AI coach that supports you step by step. You can check it out at. Now, let's clear up the biggest misconception I hear all the time. The idea that your vagina will close up or become tighter if you don't have sex. In a healthy vagina, assuming no medical skin conditions like lichen sclerosis, this simply does not happen. The vagina is made of incredibly flexible, elastic, muscular tissue. It's built to stretch and then return to its normal size. It doesn't shrink, seal, or close just because you're not sexually active. However, there can be changes in blood flow, muscle tone, and lubrication, which is something we'll discuss in detail. Another common belief is that if you stop having sex, your libido will vanish forever. In reality, desire is influenced by hormones, mental health, stress levels, and emotional factors, not just how often you're sexually active. Taking a break from sex does not mean you're destined for lifelong low desire. So let's talk about what the research actually shows. Physiologically, your vaginal tissue stays healthy because it receives blood through a network of tiny vessels. Whenever you experience sexual arousal, whether with a partner or on your own, that blood flow increases. And this extra circulation helps keep the tissue flexible, naturally lubricated, and overall healthier. So when you go long periods without sexual activity, you may notice a few changes. The first thing many women notice is a change in lubrication. Your vagina normally creates a baseline level of natural discharge, but arousal boosts that lubrication even more. Arousal doesn't always mean sexual stimulation. It can be emotional, mental, or physical. But when you consistently go without any kind of arousal, you may notice less natural moisture or simply a different kind of wetness. This becomes even more noticeable during perimenopause and menopause when estrogen levels drop. Low estrogen means the body produces less natural lubrication overall. The second change is elasticity. Vaginal tissues contain collagen and elastin, the proteins that keep the tissue soft and stretchy. Arousal and penetration help maintain that stretchiness. So after a long break from sexual activity, things may feel a bit tighter or less comfortable at first. But once you become sexually active again, the tissues usually adapt quickly. The vagina is incredibly resilient. It's also important to understand that research often compares women who have regular sex with women who don't, but the groups aren't always equal. Some women avoid sex because they already experience discomfort or pain, not because nothing is wrong. So if sex feels uncomfortable, painful, or simply not right, please talk to your gynecologist, urologist, or urogynecologist. Sex should *** never *** hurt, and there are treatments that can help. These elasticity and lubrication issues are especially common during perimenopause and menopause when estrogen levels naturally decline. The third change involves pelvic floor muscles. During orgasm, those muscles contract rhythmically, which actually helps keep them strong. Think of it as a hidden workout for the pelvic floor. I've even made a video explaining how orgasms and Kegel exercises both support pelvic floor strength in similar ways. But remember, you don't need a partner to maintain that muscle tone. You can reach orgasm on your own, or you can simply practice pelvic floor exercises like Kegels or other strengthening routines. The fourth area that can be affected is mental health. Taking long breaks from sex can influence your mood, stress levels, and even how connected you feel emotionally, but this varies a lot from person to person. Some studies show that when you're not having regular sexual activity, you might experience lower mood, more stress, or even changes in sleep quality. But this is not true for everyone. A lot of people feel perfectly normal without sex. So what really matters is how you feel. If you're not experiencing dryness, pain, urinary leakage, or pelvic floor weakness, then there's nothing to worry about. You're doing just fine. However, stress and anxiety can have a big impact on the pelvic floor. When your stress levels rise, your pelvic muscles can tighten too much, something called a high-tone pelvic floor. This can lead to painful sex, urinary issues, constipation, back discomfort, and even pelvic pain. So reducing stress is an important part of staying healthy. And if sexual activity happens to lower stress for you, feel free to include it in your routine. As many of you know, I believe sexual wellness has so many benefits. Emotional connection, pleasure, relaxation, and regular orgasms can all support overall health. But the main point is this: taking a break from sex does not put you in a use it or lose it situation. Sex boosts blood flow and activates the pelvic floor muscles, which is helpful. But when you're younger and still producing plenty of estrogen, your tissues already stay healthy, thick, flexible, and naturally lubricated. So for premenopausal women, long periods without sex generally don't create big issues. Your tissues are strong, adaptable, and recover easily. Things change once you enter perimenopause or menopause. As estrogen levels drop, the vulvar and vaginal tissues begin to thin out. You may notice less moisture, less elasticity, and more dryness, a condition known as genitourinary syndrome of menopause. The labia minora may shrink, and even the clitoris can experience some atrophy because of the reduced hormones. The good news: there are many effective treatments. Vaginal estrogen is one of the best options, and the FDA recently removed the black box warning because the vaginal form is only minimally absorbed. It does not increase the risk of breast cancer, ovarian cancer, uterine cancer, or blood clots. In fact, almost everyone, including many people with a history of breast cancer, can safely use vaginal estrogen. You can also use vaginal moisturizers, similar to facial moisturizers, with ingredients like hyaluronic acid to keep tissues healthy. And of course, lubricants are incredibly helpful. I've talked extensively on my channel about which types might be best for you, so check out those videos if you want more detail. Now, what if you simply don't want to have sex? That's completely okay. You can still support your pelvic floor in other ways. Pelvic floor exercises, like Kegels, can be great, but only if your pelvic floor is functioning normally. If you have pelvic pain, high-tone pelvic muscles, anxiety, urinary leakage, constipation, or discomfort during sex, you should see a doctor before starting pelvic exercises. A proper exam will help you figure out which type of pelvic floor routine is right for you. Orgasms can also be incredibly helpful. Even if you're not sexually active with a partner, solo pleasure and reaching orgasm can still support pelvic floor function and overall vaginal wellness. Take care of your general physical health. Regular exercise improves circulation throughout your whole body, and that includes blood flow to the vaginal area. Try to include cardio for heart health, strength training to support your muscles, and flexibility work to keep tissues moving well. All of these contribute to healthier vaginal and pelvic tissues. Third, don't hesitate to use vaginal moisturizers or vaginal estrogen, even if you aren't currently having sex. These can support comfort, lubrication, and tissue strength. Fourth, and most important, don't ignore symptoms. If you're having discomfort during sex, unusual discharge, persistent dryness, irritation, or anything that feels off, please see a medical professional. It could be something easily treatable, or it could be a sign that you need targeted care. Your body sends signals for a reason, so pay attention to them. When you do decide to become sexually active again, take your time. Use plenty of lubrication. Communicate openly with your partner about what feels good or doesn't, and allow your body to fully warm up. If you experience mild discomfort at first, it often improves with time, arousal, and consistent lubrication. Now, let's talk about what I see in many women. A lot of people stop being sexually active not because something is wrong, but because their desire has changed. This is incredibly common. Around 40% of women experience low libido, and about 12% feel distressed enough to need treatment. Low desire can have many causes: relationship stress, everyday life pressures, sex that doesn't feel enjoyable, hormonal shifts. The encouraging news is that we do have treatments. There are oral medications like diflubanserin, injectable options such as Vyleesi bremelanotide, and even off-label topical testosterone for postmenopausal women. I've covered all of these in detail in other videos, so if you feel like you've lost your desire or you're missing that part of yourself, know that help exists. And for the men listening, you play a huge role in this too. Creating an atmosphere where desire can grow is essential. Long-term relationships can easily fall into repetitive patterns, so it's important that your partner feels wanted, seen, and emotionally open to intimacy. Desire often starts long before sex. It might mean sending a sweet or flirty message during the day, giving a gentle touch on the back or shoulder, offering affection without expectation, or reminding your partner how attractive they are. These small gestures build emotional intimacy and mental desire. So when it's finally time for sex, your partner feels receptive, confident, and excited. You can also think about setting aside intentional time for intimacy. This doesn't always have to mean having sex. It can simply be spending time together, cuddling, relaxing, being close, maybe even being naked without any pressure to perform. The goal is to reconnect and enjoy each other's presence. That emotional closeness often leads to better physical intimacy later on. Another reason many women become sexually inactive is because their partner is dealing with erectile issues ***. And this is incredibly common. About half of men over the age of 50 will experience some level of erectile dysfunction. When this happens, many couples quietly stop trying because penetration becomes difficult or stressful. But here's the important part: there are many effective treatments for erectile dysfunction, and intimacy does not have to revolve around penetration. There are plenty of ways to stay physically and emotionally close. If you're watching this and your partner might be struggling with erections, encourage them to speak with a doctor. Erectile dysfunction can be an early warning sign of cardiovascular problems. In fact, within about 7 years, 15% of men who develop ED may also develop heart issues, including risk for heart attacks. You're not going to lose your vagina if you stop having sex, but the tissues can change, especially after menopause. This happens because ED is often related to poor blood flow, so it's a signal that something deeper may be going on. Here's the bottom line: staying sexually active, whether with a partner or solo, helps boost blood flow, maintain elasticity, and support pelvic floor strength. And of course, intimacy strengthens emotional bonds, which is great for mental and physical health. If this information was helpful, please consider subscribing. Only a small portion of viewers are actually subscribed, and it really supports the channel. And if you know someone who could benefit from this, feel free to share the video with them. And as always, take care of yourself because you truly deserve it.